from the patient side, the bigger responsibility is of the patient. Now, what is happening? Patient takes a prescription from the doctor, and then patient just never follows back. Like many patients don't follow back with the follow with the doctor, and they keep on taking the medicines from using the same prescription. And in India, there is no validity of the prescription. We write it, but nobody bothers about it. So when you write a prescription to somebody and write, say, example, injection Mounjaro, so that prescription is valid for 4 doses, right? Because a pen contains 4 doses, but the patient will keep on going and taking the medicine from here and there, and without any supervision, uh, just just take them because they feel that okay, A is giving us a better deal, B is giving us a better deal. Why I'm going with 5 mg? My weight loss is slowed down. I take 7.5 and all. They do that. They do those mistakes, and they don't do supervision, and they land up in the complications. And the most common complications where they'll end up again is associated with either gallbladder or with the pancreas. And now these complications are piling up because of the unsupervised treatment taken by, or unsupervised medication taken by these people. So the patients have to be very clear that they need to follow with the doctor. They should never take these medicines because the next door is taking the medicine, or somebody in the family is taking the medicine, or share the same medicine with his or her, either the spouse or the sibling or whoever. They should never do that. Proper supervision, proper screening, proper follow up with the doctors is very, very important. Patients don't need to, should not get carried away by the promos which are coming on the social media, or the social media like Instagram reels, or the big advertisements happening here and there, and start these medications by themselves. This is something what patient need to understand. Patients should always follow the dietary recommendation given by their doctor. They should not make their own, those experiments. And very importantly, they should stop following those diet apps when they are on these medication, because these diet apps don't understand, the seriousness of these medications. So therefore, the role with the doctor is very, 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 very important. Patient needs to be away from alcohol and smoking or any other recreational drugs if the patient is using. Very important. So these are the things what a patient has to do. Patient has to understand that it is their right, and it's the duty of the doctor to discuss these medicines with them, discuss the eligibility of these people with them, discuss the fitness, discuss the contraindication, discuss the dose. This is absolutely understood that these are the right of the patient and the duty of the doctor. But patient also has the responsibility to take care of themselves and follow the guidelines very compliantly, religiously. And I should say use the word fanatically here. I'm using the word fanatically because these medicines, if are being prescribed, should be used fanatically by the patient with all the guidelines given by the doctor. And then comes the third party. The third party is the pharmacist, the